Greetings and welcome back to Church in the World. This is part 5, session 2, or the second part of our discussion of uh, the ELCA's social statement for healthcare. That is to say, a caring and for health as a shared endeavor. Today we're going to talk about the vision of healthcare and healing as a shared endeavor that we have as church in light of what we just talked about last session, which is the crisis in health and healthcare in our current circumstances in our current era, and also the biblical definitions and uses of the terms as holistic, right? That the church has a role to play in health and healthcare, that also so does the individual, and so too does the whole society. We have a mutual and shared responsibility communally and socially for health. Health is holistic and communal and involves the body and mind and spirit and all our relationships as well. And so too does illness. Illness can occur in any of those things. That healing also involves the restoration of wholeness and unity to those things. Healing is, of course, one of the major focuses of the church because it was a major focus of Jesus' ministry. And that healthcare then is a shared endeavor between all individuals and all communities and the church and the society and the government as well. So we're going to talk about what that kind of breaks out to today. We're going to talk about the shared endeavor that we all share. We're going to talk about personal responsibilities, congregational ministries, social ministries, and advocacies, all of which are ministries of the church. And then we're going to talk about how we can have better healthcare services socially in our society, what a vision of better health services would mean socially. So we'll talk about that today. Let's start with personal responsibilities, okay? First of all, piecemeal efforts to reform health care without a clear goal will always be inadequate to the task. We need to have a vision of healthcare as a shared endeavor that builds upon the basic dimensions of health, illness, healing, and healthcare in relation to the interdependent responsibilities that must be addressed if progress towards better healthcare is to be achieved, right? So in other words, we can't get to a better shared endeavor for healthcare if we don't agree on what healthcare is for, if we don't agree on what health is. We won't have a goal to meet, and everything will be going in different directions. We have to have, as a society, a common vision of what this looks like. So here's what the church talks about. Here's what the ELCA talks about. First of all, there's personal responsibilities. Every one of us, of course, we all have to do personal stewardship of health, right? That's something only we can really do effectively. And that means promoting health and preventing illness and disease. You got to eat well. You got to get an adequate exercise and sleep. You got to avoid use of tobacco and drugs. You got to limit your alcohol consumption. You got to use car seat restraints. These basic things that they teach you they taught me in middle school. It means balancing responsibility with health with other responsibilities to other persons and other things in life. It means seeking care as you need that care, recognizing that disability, disease, and illness just occur. They do occur even to those who are good stewards of their health. Being ill or experiencing illness is not to say that something is wrong with you, right? It happens to everybody. Everyone can and often does experience some form of illness. Now, health is a blessing from God, and it's proper that we attend to our health and healing. But we show sin's power when we become unduly absorbed in our own selves and make health an idol by denying our own mortality. So this is the opposite end of that, right? Instead of proportional stewardship, we get completely warped, right? And so I think I've even may have mentioned this last video. Persons who are so obsessed with their own health that they actually wind up harming others or ignoring other responsibilities and other aspects of their health. So you've heard of workout addicts, people who just find another way to be addicted. That's an illness just as much as alcoholism is, right? Just as much as workaholism is. It's disproportionate and it's unbalanced and disunified from the rest of the body and the rest of our health, right? If we are constantly working out such that we never do our job, that's not any healthier than never working out and always working, right? These are both examples of unhealth, right? But the temptation to make health our God can show itself in excessive preoccupation with physical appearance and a denial of aging or the inevitability of death, right? It leads us to demand unlimited resources for services that go beyond responsible stewardship of good health. We can see this in conversations about using healthcare choices wisely. Just because a healthcare treatment exists doesn't mean that it's right for me. Just because, yes, we could do this thing, and this thing might prolong life, right? That doesn't necessarily mean that's what we need to do. Some persons near the end of life may choose to forego expensive treatments, the effectiveness of which may be very limited and the quality of life under which might be very limited as well. We have to encourage each other to talk with families and healthcare providers about treatment goals and types of care and make decisions that reflect our responsibility to be good stewards of our health and the resources that are available to us. We have to live with the tensions created by the limits of the resources that we have for healthcare. We hope for healing in this life, and we trust in God's promise of wholeness and eternal life, right? So we prepare for future healthcare choices. We talk with our families about end of life care situations or situations where we are no longer able to care or speak for ourselves. These are things that you should talk about with your family if you are in any likelihood of having to do so, and maybe even something you should talk about just in general. I know that my parents are both aging, and I've had to have some healthcare conversations about that with them both, and they're both still able to speak for themselves, make decisions for themselves, and care for themselves. And I've already seen it because I know that the day comes when, and it normally comes without apparent warning, that a decision has to be made about how we're going to care, how that person's going to go forward, right? As a pastor, I see a lot of this. I've pastored a lot of people as they go from completely independent living to independent living, but my kids have to come over to check on me, to I need a life alert, to maybe I should live in a retirement community, to I need to live in a care facility, to I'm on hospice, right? And this is not uncommon as a trajectory. Everyone goes through some version of decline unless they die very suddenly and without warning. And that's traumatic in its own way. And another thing that we need to consider as we make responsible decisions about our own care and our own healthcare decisions, right? Now, our responsibilities for health extend to helping others meet their needs while supporting them as they take responsibility for their own health care. We all have opportunities with our family, friends, and neighbors to provide meals, transportation, or comfort to those who are ill and to support professional and volunteer caregivers. And we have opportunities to pray for one another. We should take care not to blame people for their health problems, and we should work to minimize both the stress of coping and the potentially isolating stigma of some health conditions. And most of all, we stand ready to be present with and care for those who suffer, whatever the reason for their suffering. As citizens, that is to say, in our role as private citizens of the United States, we ought to support those disease preventing and health promoting public health measures, such as vaccines, that can be taken only at community, state, and national levels. We also have responsibilities to support similar efforts that address disease prevention, health promotion, and treatment on a global scale. Really, really important stuff. And that's our personal responsibilities. Now let's talk about the church very briefly. Now we've already talked about this a bit, right? How the church is a ministry of healing um, in many senses. Okay, the church expresses our faith in the power of God. It supports the obligations of a society to serve those who are left out and to be present with those who suffer. And the church has its source of this ministry in Christ's healing work and continues to carry out Christ's healing work in whatever ways are available to us. The church's ministry is free to contribute to the healthcare system as well as to address the injustices of that healthcare system. So congregations, and the statement goes on at length. I'm just going to briefly breeze by this because if you've been in a congregation, you'll know this, right? What are the benefits of the congregation towards healing? Well, worship is the center of the congregation's ministry of healing. So everything in worship, Holy Communion, baptism, preaching and hearing the word, the promise of the forgiveness of sins, the liturgy is a structure of meaning, music and hymns that bring comfort and healing to those who are suffering, education, pastoral care, equip people to understand better and cope with illness. Congregations provide people with acceptance, support, and community. Congregations listen. Congregations bring suffering, injustices, and concerns to God in prayer. Congregations hold all these dimensions of healing in the life together and in special liturgies of healing. Congregations make special provision for those who are ill to hear the good news and receive Holy Communion. Members visit the sick and the dying. They encourage and pray for those who are in healthcare occupations or are voluntary caregivers. Some congregations even develop specific healthcare ministries that include counseling centers, healthcare advocacy, congregational health ministry teams, parish nurse ministries, provide for wellness programs, etc. All of this and more, right? But we're not going to spend a lot of time on that because I'm sure that you can read the statement for yourself if you want to. If your congregation is interested in promoting health and healing and wants to look at other ways you could do that, look at this statement. Links in the doobly-doo. That is to say in the down low part, the comments of the description of the video. I've watched too much Crash Course. Now, also, the church has social ministry organizations. I'm going to go through this very briefly. This is things like Lutheran Social Ministries. This is things like Lutheran Immigration Refugee Service. This is something like any chaplaincy work done for a group of people. There's one for seafarers. I know that. There are any number of hospice chaplains that are Lutheran. The Lutheran Church has a whole bunch of different social ministry organizations. Advocacy also falls under the umbrella in a certain sense. There's healthcare facilities, retirement facilities, all sorts of things like that, right? Why? Well, because the ELCA, right, as part of the church, steps in where the systems of the society have failed and left people out. And for that reason, the statement, and this is a direct quote, the Evangelical Lutheran Church in America calls upon government at all levels to provide sufficient and timely reimbursement to social ministry organizations for the services they offer on its behalf, allowing them to fulfill their missions with integrity and faithfulness. We also call upon leaders of these organizations to promote public policies that tailor services in greater measure to those whose needs for healing and access to health care are most often neglected, especially those with limited financial resources, and that gets into advocacy, right? And advocacy, of course, is influence of those in power on behalf of the neighbor. The church does this. It's commonly called, when it's done by for-profit corporations or private interests, it's called lobbying. We call it advocacy because it's not lobbying on our behalf. We do not talk to the government about what we want because it serves us. We talk to the government about what the neighbor who the government is neglecting, ignoring, or failing, what that neighbor needs for their life and livelihood. So we don't speak for ourselves there. We're not talking about our needs. We're talking about the needs of the neighbor, right? The person the government is supposed to serve and is trying to ignore. That's what advocacy is for. It's a corrective to governments, right? It's something that the church does. It's a ministry of the word. Okay. And then better healthcare systems. Look, a healthcare system should have the explicit purpose of promoting and improving the health of all people, reducing the impact and burden of illness, injury, and disability, and promoting healing even when cure is not possible. But too often, the various sectors of healthcare and health promotion are fragmented and disjointed. This inhibits equitable access to health-related services and good quality care, especially when individuals are unable to obtain treatment they need. This system should be coherent, with the different services being functionally interrelated and mutually accountable. No one group, public or private, can design the structure or financing of such a system alone. Representatives of all groups that provide services and financing must seek together a solution that enhances our interdependence. Healthcare is a shared endeavor, entails a comprehensive and coherent set of services of good quality care throughout one's lifespan. At minimum, each person should have ready access to basic healthcare services that include preventative, acute, and chronic physical and mental health care at an affordable cost. We're going to say this again. At a minimum, each person should have ready access to basic healthcare services that include preventative, acute, and chronic physical and mental health care at an affordable cost. The United States does not currently have a healthcare system that is capable of care for all people. Significant changes in financing and structure are therefore required. Discerning what these changes might entail within the limits of what is economically and politically feasible needs to be worked out. It's a shared endeavor in the democratic process, right? The church is not in the business of just handing down an edict about that. Without attempting to describe all the components and attributes of such a system in detail, the following highlights some particular concerns. Public health services. Look, because the current system is inadequate and not functioning to provide what we believe is the bare minimum that the society should provide for each individual. We have to be clear about this. Health as a shared endeavor makes public health services, which focus on the public population as a whole, the foundation for any healthcare system. We urge renewed political and financial support for services undertaken on behalf of the entire community to prevent epidemics, limit threats to health, promote healthy behavior, reduce injuries, assist in recovery from disasters, and ensure that people have access to needed services. The failure of this country to engage in such a thing, this is just me, but the failure of this country to establish such a thing is one of the reasons that the COVID-19 pandemic has killed over 500,000 Americans in a year. Governments have an obligation to provide or organize many of these services, but all services depend on active collaboration with the entire community, right? Since threats to health do not respect national boundaries, we also need to cooperate internationally on public health efforts. That's another thing that our system has to do better. In facing this global challenge, the US government and non-governmental organizations have a responsibility to work with others in such areas as securing clean water, sanitation, overcoming hunger, malnutrition, preventing and combating infectious diseases such as COVID-19, responding to disasters, and providing health services for women, men, and children who live in poverty. We also believe in whole patient care. Any person seeking healthcare ought to be treated and respected as a whole person, not merely as a site of disease or injury. Healthcare should attend to the physical, spiritual, and mental dimensions of the person seeking care, right? Pastoral and spiritual care should be available at all levels of healthcare services. We endorse efforts to incorporate mental health services more substantially within the healthcare system and to grant mental health needs parity with other healthcare needs. The debilitating suffering caused by mental illness for both sufferers and loved ones is intensified by the labeling, isolation, and moral blame that often accompany such illnesses. Whole patient care also requires attention to the following: professional patient relationships, right? A partnership of trust in pursuit of a shared goal appropriate to each individual circumstances. There has to be trust and cooperation between professionals and patients. Doctors and hospitals should give full information on measures that might be taken. Good care requires healthcare professionals and patients to deliberate together on the facts and values in each option. All care, using either standard or complementary approaches, should serve the patient's best interest, recognizing the patient's increased vulnerability during times of illness and respecting ethnic and religious differences. Informed consent is a moral and legal requirement. Professionals should never abuse their power, but always foster relationships of trust. Does this sound familiar? It should. It'll come up again. Trust is so essential to what we talk about in society. Whether or not you're a Christian, trust is at the center of our relationships, and we need to remember that. Cure is central to healing and often a major goal for healthcare. We celebrate cure. Great. Patients and caregivers should not, however, see lack of cure as failure or cause for abandoning other forms of healing and care. We support both patients and care providers in making difficult decisions that they no longer will seek cure in particular instances. We can always care even if we cannot cure, right? If you've ever had a person who's chronically ill, or terminally ill in your life, you know what that was about, or at least have had some painful examples of that. Many people also live in need of long-term health care because of illness or disability. Successes in saving or prolonging life has led to an increase in these numbers, but a healthcare system must attend to their needs. Healing for persons living with chronic conditions requires attention to loss of bodily integrity and wholeness, questions of meaning, disruptions of relationships, etc. An essential part of this healing is ongoing caring presence of healthcare professionals and chaplains, as well as other caregivers. There are also other approaches to healing. There's palliative care, right? There's peaceful dying. Then we have to talk about caregiver support and how we're going to support caregivers as a society, all of whom require adequate pay, benefits, and good working conditions to support and maintain the number of skilled caregivers. I just heard on the news just recently a study about how horrific the conditions for healthcare professionals has been during the COVID-19 pandemic. This is really important stuff. When our caregivers are not healthy, how are we going to help others attain health, right? When the people who are caregivers are unhealthy. And then, of course, we recognize research and technology development and the fruits of medical research and innovation are means often through which God blesses and heals creation. So we commend the important work of medical research and we support investment in the goals and healing afflictions, relieving human suffering, and promoting well-being. We affirm the important service to God and neighbor rendered by those who develop and use curative technologies and practices, but we caution against unrealistic faith in technological progress, right? We don't believe that R&D is going to solve everything. We want to be aware of what we need to address first. Healthcare research first should address those medical interventions that are likely to improve substantially the overall health of the general population. While we cannot explore the many questions raised about particular research endeavors, this church supports research that is consistent with the perspectives of the social statement and widely accepted standards of biomedical research, right? So research, good, never going to solve everything, needs to be prioritized based on what is going to achieve wellness and wholeness and healing for the society and the population as a whole, not for very specific tech concerns. And that's primarily, I think, aimed at keeping research and technology development in healthcare from being oriented only to private personal concerns. And then, of course, healthcare professionals should all have access to affordable and comprehensive education that keeps them up to date and equipped. All of these things should be fairly common sense, but all of them have been coming under debate in the United States of America. So, what then do we do? How do we talk about justice in healthcare? How do we talk about equitable access to healthcare for all? How do we talk about love and justice meeting together in our healthcare system? How do we make personal ethical decisions around healthcare? And then how do we advocate for public policies that will promote this mutual endeavor, this common endeavor of health? We'll talk about that next time. Until then, God bless.